webinar series. I'm Heather Batt, Executive Director for the Research and Training Institute at Cancer Support Community. The Cancer Support Community is a global nonprofit network of 175 locations, including CSC centers, Gilda's Club, and hospital and clinic partnership that deliver more than 50 million in free support and navigation services to patients and families. We administer a toll-free helpline and produce award-winning educational and digital resources that reach more than 1 million people each year. We also conduct cutting-edge research on the emotional, psychological, and financial journey of cancer patients and advocate on all levels of government for policies to help individuals whose lives have been disrupted by cancer. In honor of National Family Caregivers Month this November, we're excited to offer this 4-part webinar series for cancer caregivers. We recognize the important role you play in the life of your loved one and joys and challenges you may face as you navigate the caregiving experience. We thank you for taking time to join us today and for the invaluable and instrumental care you provide. It is now my pleasure to introduce our presenter, Dr. Allison Applebaum. Dr. Allison Applebaum is an associate attending psychologist at the Department of Psychiatry and Behavioral Sciences Memorial Sloan Kettering Cancer Center and an associate professor of psychology in psychiatry at the Weill Cornell Medical College. She's the founding director of Caregivers Clinic at Memorial Sloan Kettering that's housed in the counseling center. The Caregivers Clinic is the first of its kind and provides comprehensive psychosocial care to family members and friends of patients who experience significant distress and burden as a result of their caregiving role. Dr. Applebaum's program of research focuses on the development and dissemination of psychosocial interventions for cancer caregivers, as well as understanding the impact of caregiver psychosocial well-being, prognostic awareness, communication skills on advanced care planning. She has published over 100 articles, reviews, book chapters on these critical topics, and is the editor of the textbook Cancer Caregivers. Dr. Applebaum has also received competitive funding for her research, including awards from the National Cancer Institute, the National Institute of Nursing Research, and the American Cancer Society, the T.J. Martell Foundation, and the Van Amerongen Foundation. Please welcome Dr. Applebaum.
Thank you so much, Heather. It's such an honor to be joining you all for National Family Caregivers Month. This is such an important time. We, of course, always need to honor caregivers, but it's a special time this month to do so. So just to start, I want to acknowledge disclosure that I do receive funding from Blue Note Therapeutics, but that work has nothing to do with anything I'm speaking about today. So today I'm going to be speaking about the responsibilities and challenges faced by caregivers, common mental health concerns about caregivers, the benefits of professional support, and even the potential benefits of caregiving. So who are cancer caregivers? I always like to start with the words of former First Lady Rosalind Carter, who's very famous for saying that there are only 4 kinds of people in the world: those who've been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. This means that we all fall into this category, and oftentimes repeatedly throughout our lives. So before the pandemic, I actually took a look at the articles published in the New York Times in the prior 4 years, and I was struck just in the New York Times by how many articles focused on the topic of caregivers. And this is probably just about 25% of the titles that I found. So a shortage of caregivers. More caregivers are no spring chickens themselves. Daughters still are the caregivers. Caring for the Alzheimer's caregiver. Who will care for the caregivers when the caregivers need healing? A living wage for caregivers. For some caregivers, the trauma lingers. A millennial caregiver. My family cared for my sick aunt. Who's caring for us? At 75, taking care of mom, 99. We didn't think she'd live this long. Pressed into caregiving sooner than expected. Caregiving is hard enough. Isolation can make it unbearable. Strategies for long distance caregiving. Medicaid patient shift squeezes home caregivers. Training needed for home care is lacking. Daughters will suffer from Medicaid cuts. Caregiver plus MD or RN. Caregivers sometimes must sacrifice their careers. And bear with me, my all-time favorite, how getting high made me a better caregiver. So these titles speak to the range of challenges faced by caregivers and those that we as healthcare professionals must address, from the financial toxicity of caregiving to the fact that so many of you are providing care at a distance, and the reality that the challenges and distress associated with caregiving don't end with the death of the patient. So what do the at least 53 million US caregivers do? And I say at least because this is a pre-pandemic estimate of all the caregivers in the United States, 2.8 million of whom are providing care to patients with cancer. The answer is caregivers do absolutely everything. In fact, if you're a caregiver, you know that is the case. So caregivers are providing help with activities of daily living, instrumental activities of daily living, helping patients to get dressed, to get out of bed, to get to the doctor's appointments, to take their medications, to manage living at home as independently for as long as possible. Importantly, caregivers provide emotional support. And this is often at a time when you as a caregiver may not actually be receiving the same level of emotional support from the patient you're taking care of. And so there's a mismatch of support received. Very importantly, caregivers provide nursing support. And in fact, a study by the National Alliance for Caregiving found that close to 75% of cancer caregivers provide nursing support. And importantly, this is often done without formal training to do so. We know that caregivers are taking on responsibilities that really were once just those held by trained medical professionals like doctors and nurses. On average, caregivers provide care for 8.3 hours a day for 13.7 months, and nearly a quarter are providing care for more than 40 hours a week. This is absolutely a full-time job conducted in addition to full-time paid employment. And a pre-pandemic estimate of the value of caregiving in the US was $375 billion. We can imagine it's much greater right now. It's very clear that caregivers are absolutely critical to our healthcare system in the United States today. We did not need the pandemic to highlight, to underscore the incredible work done by caregivers, but certainly the pandemic has done that. It's shown a bright spotlight on the significant responsibilities that caregivers take on and how we all depend on caregivers. In fact, I recently said that I think that caregivers are really making up for all of the gaps in this country's lack of a long-term care system. Caregivers are that system. Caregivers are basically doing everything. And it's not surprisingly that as a result of all the caregivers are doing, most of us as caregivers will experience at some point what we call caregiver burden. This is an umbrella term, an overarching term that refers to all the ways in which the caregiving role can potentially negatively impact the caregiver. The first component of burden is psychological. We know that diagnostic rates of anxiety and depression are higher in caregivers than the patients for whom they're providing care. I want you to sit with that. And if you're a caregiver, I wonder if this resonates. Research shows that the mental health concerns are actually greater in caregivers than patients. And increasingly, since the beginning of the pandemic, we are seeing post-traumatic stress symptoms of trauma in caregivers. There's a physical component to burden. Caregivers are at risk for their own physical and medical problems like cardiovascular disease, poor immune functioning, fatigue and sleep difficulties. And all of this combined with the fact that caregivers oftentimes aren't able to take time for themselves to go to screenings, we are seeing higher rates of mortality in caregivers than in the general population. There's, of course, a financial component to burden. The phrase financial toxicity gets used a lot in talking about the financial implications of cancer care. Well, the impact of caregiving has its own financial toxicity, and this certainly can last well after a caregiving journey has ended. There's a temporal or time burden. As I said, this is a full-time job. And there's an existential component. And this has really been a focus of much of my research over the past decade. When I talk about existential distress, I'm referring to the distress that we experience when we realize that we are human, we are mortal, and we and those we love will eventually die. And of course, caregivers in their role are faced with this distress and oftentimes face incredible challenges around one's sense of identity. Who am I now that I'm a caregiver and not working full time? How can I live life fully now, knowing that he's not going to be here in the future? I feel guilty about thinking about the future when my husband's no longer going to be here. Am I normal? These are all existential themes that come up and certainly are a component of burden. Now, very importantly, we know that when left untreated, this distress, this burden increases exponentially across the caregiving trajectory. So we have to have support. We have to have support early. We also know that there are particular times in this trajectory when distress is uniquely high. And the latter two categories here are likely no surprise to anyone. Of course, if you're in this situation where your loved one transitions to hospice care and you eventually into bereavement, of course, that's a period of incredible distress. But I want to highlight earlier on what we call survivorship. And survivorship is an interesting moment because it's a period when, among patients, we often see an increase in quality of life, an increase in well-being. Patients will say, I'm returning to my life, I'm returning to my new normal. We see a decrease in distress in patients. We actually see, paradoxically, the opposite experience in caregivers. We actually see an increase in distress in caregivers when patients enter survivorship. And one of the reasons for this may be the fact that for many caregivers, perhaps yourself included, during your loved one's initial phases of diagnosis and treatment, you were in fight or flight mode. You were doing everything that you could to take care of your loved one. And that probably included damping down some of your emotions. And so what happens in survivorship is you can finally take an exhale. Your loved one's doing fine, but with that exhale, all of those negative emotions, all those really scary thoughts you had been avoiding come back. And that's why we see an increase in distress. And I bring this up because from a health systems perspective, this is the same moment when caregivers such as yourself become disconnected from our hospitals, from our community centers. And it's the same moment actually when you need great support. So if you are a caregiver of a patient in survivorship, this is the time to seek out care. So what type of care might you seek out? There is a lot of care out there, and I want to describe the different types of care available to you so that hopefully you can feel a little better equipped in making decisions about the type of care that is right for you. So the first type of care is one-on-one counseling, such as a caregiver coming into the caregivers clinic at Memorial Sloan Kettering Cancer Center and receiving support with myself or a colleague. This is particularly helpful when one is experiencing very high distress. There's also benefit if your partner is the patient with cancer and you are taking care of them. Engaging in couples therapy with your partner who's the patient can be very helpful in navigating some of the challenges of caregiving. Now, if the person you're taking care of is not your partner, engaging in family therapy is another option. Family therapy can also be really beneficial if you are finding that navigating various caregiving responsibilities with other family members is difficult. For example, maybe you are the primary caregiver for your mother, and you have two siblings who are also involved, but peripherally so, but disagreeing on many of their responsibilities. Well, family therapy would be a great thing to do. Medication management. This is taking psychiatric medications to help manage symptoms. And while I'm a clinical psychologist by training, I will say that there is a time and place for medications. And if you are a caregiver in high distress, you're experiencing significant symptoms of anxiety or depression or trauma, speaking with a psychiatrist or psychiatric nurse practitioner can be very, very helpful. Medications are great when used in periods of crisis, and certainly the caregiving trajectory is one of many crises. There are also many groups out there for caregivers, and I have mixed feelings about groups, and I'm going to be transparent with you about my feelings today, and it's that the groups can actually be very helpful or very harmful. The groups that are harmful in my experience are groups that are called open drop-in groups, where anyone can show up at any time. And that means you don't actually know who's going to be there, and you actually don't know what the composition and the dynamics of the group are going to be. And oftentimes these groups can feel very overwhelming to caregivers. On the flip side, closed groups, those groups that have a set number of caregivers who are going to come every week or every month for a certain period of time, get to know each other, develop relationships, And groups that are led by a mental health professional are actually quite helpful, quite beneficial. Groups can help you to feel less alone. They can help you to learn new ways to cope with caregiving, and they can help you to feel connected to others in a similar role. In addition to working with support groups, I also encourage you to seek out peer support. I think peer support is a phenomenal adjunct to professional mental health care. So here at Memorial Sloan Kettering, for example, we have the Caregiver to Caregiver program, where we pair current caregivers with our experts. These are caregivers who were once in the role, they're no longer in the role. They can provide expert support, feedback, guidance, and this can be done flexibly. And so if you're someone who may not feel great about working with a mental health professional, perhaps you're someone who might really enjoy speaking with a peer. There are a lot of mobile apps out there, and mobile apps that focus on helping caregivers to manage various aspects of their role. I think these can be a wonderful adjunct to support with a mental health professional, a counselor, either delivered on the computer or in person. There's a lot of apps out there that are really also good for general stress management, for helping with sleep, helping with relaxation. It's also important to acknowledge the spiritual and existential components that come up in a caregiving journey, and there's great benefit in speaking with spiritual and pastoral advisors. Certainly if you're someone who is struggling with spirituality or religiosity in the context of your caregiving journey. And finally, there are online forums. This is one of them, a great opportunity to come together and learn, but it's also important to note that this is not psychotherapy. And so if in listening to me speak today, you're realizing, wow, I could really benefit from support, well, this is really my plea for you to take some steps today to find that support. So what are the reasons why you might want to come in for support? What are the reasons why caregivers come to our clinic? One of the major reasons why caregivers come in is they find it incredibly difficult to communicate with healthcare professionals. They don't know what to say in meetings with the doctors, and oftentimes they don't actually know how to talk to their loved ones, to the patients. And so we do a lot of what we call communication skills training. We also do treat a lot of anxiety. And in fact, if there's one common anxiety-related experience among every caregiver, regardless of their loved one's site or stage of cancer, regardless of the type of treatment, and regardless of how long one's been a caregiver, that is the challenge of sitting with uncertainty, of not knowing what the next year or month or week or even hour might bring. And so generalized anxiety disorder is one diagnosis that is really characterized by a difficulty with sitting with that uncertainty. And we do a lot of work to help caregivers such as yourselves to actually develop skills to sit with that anxiety. I'll also say that one of the most distressing concerns among caregivers is insomnia, difficulty sleeping. I wonder if this is the case for you, but many caregivers have had no issues sleeping in the past, but now that they've been in the caregiving role, they are really struggling to fall asleep, to stay asleep. And so this is a good reason to go for support if you're finding this is a concern for you. More generally, many caregivers really struggle with how to maintain a balance between their caregiving role and all their millions of other roles and responsibilities in life. And as I mentioned, of course, we do provide support around existential distress, death anxiety, and certainly this is a great reason to seek support. The more and more, and this is the cliff notes here, the more you can express your emotions out loud, getting them out of your mouth, out of your brain, actually expressing how you're feeling while you're a caregiver, it's going to serve you well for years to come. In addition, of course, to all of this professional support, it's very important that we all take responsibility for our lives and we engage in self-care. So I think self-care gets a bad rap, sort of misunderstood. It's about being deliberate and taking time for yourself, for the betterment of your mind, your body, and your soul. It is not about being selfish. It's about replenishing and refreshing yourself. So I can't see all of you, but I would say raise your hand and tell me when self-care is needed. And the truth is that self-care is always needed. We all need self-care every day, but there are particular times when self-care is particularly needed, and that's when burden is high. And we know burden is high if we are a caregiver. We are finding that it's more and more difficult to carry out our responsibilities to take care of our loved one. We know burden is high when we're angry. We're getting angrier than usual, when we're just irritable. We know burden is high when we have more medical problems. We're more susceptible to colds and flu. And we know burden is high when we feel depressed. And even if we were to express some feelings of this life is not worth living. These are all moments when mental health care is important as well as self-care. 99% of the time when I bring up self-care in clinic, caregivers will say to me, great, but I absolutely have no time to do anything. And that's real, and I want to acknowledge that. And I actually want to share with you, I think it's really important, especially in this month when there are thousands of webinars out there on National Caregivers Month and self-care. I personally have a very big problem with the oxygen mask metaphor. I don't know about you, but when I was in my caregiving journey, taking care of my dad for almost a decade, I got so angry every time someone said to me, put on your oxygen mask. I kept thinking to myself, I would put on my damn oxygen mask if I could. I'm in a crisis right now. And so I want to just acknowledge that when we talk about self-care and we talk about an oxygen mask, I am not talking about moments of crisis. I am not talking about when you are in the thick of it. I'm talking about when you can actually take an exhale. No pun intended with a mask. So when you can take that exhale, I want to give you some suggestions for helping you to integrate self-care into your routine. And the first is I want you to schedule self-care as you would a medical appointment or a work meeting. In fact, it's funny because it just came up on my computer right before this. Every Thursday on my Outlook from 12 to 12:15, I actually have an appointment scheduled and it says breathe. I've carved out that time so that I have 15 minutes. Today, I'm going to do it after the talk, but making sure that I have 15 minutes to do something good for myself, whether it's go for a walk, drink a nice cup of hot tea, do some meditation. I want you to schedule it, put it on your Outlook, protect the time. I want you to do one self-care activity every day, and I want you to do more on days that are stressful, okay? These can be small, but they need to be included every day. And I want you to take an honest look at your coping. Some patients have said to me, well, yeah, I've been taking care of myself. I bought myself a nice bottle of wine. I drank half of it last night. And certainly having a glass of wine here and there is totally fine. I love wine, but going to drink alcohol as a way to cope is not healthy. And so I want you to take an honest look at how you are coping and if ultimately it's actually hurting you. And I want you to think small. I think, sometimes when we think of self-care, we think about a day at the spa. And I hope that all of you get to have a day at the spa at some point in the next 12 months. I certainly need a day at the spa. But it's not realistic to have a day at the spa every day or every week or every month. So I want you to think small. What are simple things that you can do that are self-care? And finally, I want to make sure that your self-care is in line with good sleep hygiene. And what I mean by that is for many of us, especially those of us who are both working day jobs and taking care of someone, all of our free time happens to be at night. And so many caregivers will say to me that they start going to the gym late in the day, like in the evening time at 8 or 9 p.m. And that it's great to get exercise, but the problem with that is that if you're at the gym or 8 or 9 p.m., there's no way to be asleep by 11. In fact, you want to finish exercising at least 3 hours before your bedtime. And so I really want you to think about scheduling your exercise and self-care in a way that's not interrupting your sleep. So I want to end on a higher note and say that it's not all doom and gloom. And I want to acknowledge that this is not about the power of positive thinking. I'm not talking about turning lemons to lemonade. It's not who I am as a person. It's not who I am as a therapist. But despite the challenges of caregiving, caregiving is also an opportunity to develop new strengths and to actually gain some benefits. These include an enhanced sense of meaning in life and meaning in caregiving and meaning in relationships, a sense of purpose. Many caregivers have said to me that they felt lost in the past, and it was through caregiving that they got a sense of purpose in their life, a reason to be. Many caregivers have said to me, I had no idea how strong I was until I took care of him. One can realize new strengths as a result of this role. And over time, continuing to face the challenges of caregiving, which are great and repetitive, helps to cultivate resilience. In fact, recently a caregiver I worked with during the pandemic said to me, being a caregiver in the pandemic is nothing compared to taking care of my husband after he was discharged from a stem cell transplant. This caregiver became incredibly resilient during her journey, and I hope this is the case for you. I've also had caregivers say to me that they found their voice as a result of caregiving, that, for example, they never could speak up, but because they had to advocate for their loved one in multiple appointments with doctors, that they actually found their voice, and they were able to carry that forward after their caregiving journey ended. And for many, caregiving is an opportunity for enhanced relationships. And this might be an enhanced relationship with the person for whom you're providing care, or it might be an enhanced relationship with other people in your life. Certainly, like any crisis, caregiving highlights who your friends are, who's going to be there, who has your back. And it hopefully will highlight those individuals who are worth you investing your energy in. And so certainly I've seen again and again, caregiving is an opportunity for enhanced relationships. I'm going to stop there. I want to give us some time for questions. It's been a pleasure and an honor to be joining you today. I hope that this was helpful, and I hope this has inspired you to think about your own caregiving journey, how things are feeling right now, and how professional support might be beneficial. Thank you.
Wonderful. Thank you so much, Allison. If anyone does have questions, feel free to put them in the chat or the Q&A, and we can make sure that they get answered. And if you want to also talk offline, we're happy to do that as well, but we'll give it just a couple minutes for any questions. I see someone raise their hand. If you want to put a question that you might have in the chat or the Q&A, we can be, we're happy to answer it. So there's a question to Allison that's coming into the chat. This person says, I have a 10 and 12-year-old. I would like to get them counseling, but would want to be sure I find the right therapist. Do you have any recommendations for some in the Seattle area? So I know that's not quite your location, but any guidance that you might be able to help just in general would be great.
You know, I don't personally know folks. Well, that's not true. You know, a great place to go in general to find providers is actually if there's a comprehensive cancer center. So for you particularly, you might want to look at the Fred Hutchinson Cancer Center website and look at their Department of Psychiatry and see what they have there. There are many affiliates of that department who serve the greater Seattle area. I would also say that reaching out to groups like the Cancer Support Community, the American Cancer Society, these are places that can actually route you to appropriate care. And so if you're having trouble looking, and I know looking can be overwhelming and burdensome, just ask.
Perfect. Thanks, Allison. And I do want to also mention Susan Ashley from the Cancer Support Community just put a little note in the chat about our cancer support helpline, where we do have professional navigators there that can help either connect you to resources that are local to you or also provide support over the phone. So the link is in there, and I'll make sure that we also share it in an email after the session as well, so everyone has that information. Thank you. I see there's one in the Q&A, so hold on one second as I bring that up. One person says, I have family members who are full-time caregivers and live in a different part of the country. Do you have any suggestions for supporting caregivers from a distance?
I mean, I think that this is becoming more and more the norm. You know, the advice I have in terms of supporting caregivers from a distance, number one is there is great support offered virtually, right? And so I think one of the benefits right now, and also just to say, even if you're in Seattle, there's a lot of support that you can receive from folks who are not necessarily in Washington State. So it's finding support that can be delivered over telehealth, you know, modalities. The other piece is that there's multiple family members involved in support and care. It's just really important to get as specific as possible and ask the question, what specifically can I help you with? I think very often it's overwhelming to ask for help because we're not taught to do so anytime in school, for example, but also it's often overwhelming to think about what type of support we want. If you can ask specifically what support is needed, it's going to make it more helpful for you to actually find the type of support. Many folks don't want actual mental health care. They might actually just need help with cooking or cleaning or the logistics of the day-to-day.
Absolutely. Thank you, Allison. And I will say, I'll put this in the chat as well. We do have something at CAC called My Lifeline, which is a kind of digital community, and it's a great way to, I think, kind of help address the burden from caregiving from a distance, because you can all get connected virtually and digitally, as Allison said. So we'll make sure that gets put in the chat as well. We have another question in our Q&A. The next one is, this person would love to hear daily techniques we could utilize to care for ourselves.
The most powerful and simplest technique is diaphragmatic breathing. Not sure if you can see me, but it's basically putting one hand on your chest and one hand on your abdomen, taking a minute to notice which hand is moving more, breathing the way that you've been breathing probably for a little while now. My guess is it's going to be your hand on your chest. For me, it certainly is the hand on my chest. What we want to do is we want to get that hand on your belly to move more. And the way we're going to do that is we're going to take a deep, deep breath in through our nose. We're going to hold it for a few seconds, and we're going to exhale through our mouth. I'm going to demonstrate it. When you exhale, your belly should expand. Doing this just for 1 minute can actually have a significant impact on your stress, because what you're doing when you're taking that breath in through your nose, you're getting oxygen to your brain. That oxygen to your brain is lowering your stress hormone cortisol. It's going to help you to feel calm. So that's number one. It's a great technique to do, by the way, before you have a difficult conversation, before you're going into a meeting. If you feel anxious, it's something that I use basically every day of my life. Second, there are many things to worry about as a caregiver, and sitting with uncertainty is really hard. And I don't know about you, but not being able to cross things off my list was something that was very hard for me when I was a caregiver. I think it can be very beneficial taking time each day to write a list out of what your concerns are that day and prioritize what it is that really needs your attention. There's always so much on your plate, but being able to really prioritize those things that need to be done today versus those things that can be done next week or next month, or those things you can delegate. Do that. Delegate, delegate, delegate. That's the other thing. If there are people in your network who ask, what can I do to help you? Even if you don't know right in that moment, tell them, I don't know right in this moment, but I know there's going to be something in the future. So I will get back to you and definitely ask you for help.
Wonderful. Thank you, Allison. I think one more question we have here is, what credentials should we look for when seeking telehealth for counseling services?
What a great question. So there are many different types of mental health providers out there. There are clinical psychologists who have PhDs like myself. There are psychiatrists who have MDs. And there are psychiatric nurse practitioners, NPs, and there are social workers out there. There are also licensed family therapists out there, LFTs, LMFTs. And so there's a lot of initials after folks' names. I would encourage you to focus less on the type of credential one has and more on what does it feel like to talk to this person. So when someone's looking for support, I'll say, you got to have like a quick drive-by date. What does it feel like to talk to them? Do you feel supported and validated? Do you feel like this is someone you want to open up to? Now, I will say with one caveat, if you are experiencing a high level of distress, meaning severe depression that's disabling, suicidality, thoughts that life is not worth living, this is a time it's very important that you meet with a PhD or an MD so that you can receive a very high level of care and also medications if needed.
Wonderful. Thank you so much. I don't see any more questions coming through. So I think I would just want to, well, first of all, thank Dr. Applebaum for being here and speaking to us, not only during this special month for National Cancer Caregivers, but also just in general and helping us to provide support as we move forward. And yes, I see just a note in the chat that this talk will be available later. It's available, it is being recorded, and it will be on the Cancer Support Community website. And you'll also receive a PDF of Allison's slide deck once the session ends as well through an email. And yeah, just make sure I put a link to the rest of the series in the chat. So there's 2 more sessions in the caregiver series. So please be sure to sign up if you haven't done so already. And then last but not least, we certainly want to hear your feedback and kind of help understand what else we could do to support you. So there's a quick evaluation at the end of the session, and just take some time if you are able to. And again, thanks for joining for today, and we hope to see you next time. Thank you all. Take care.